Well, the popularity of weight loss drugs is exploding. You may know someone who is not diabetic who has paid to take these drugs to lose weight.
And here today to talk about the pros and cons is Daniel Baughn. So welcome back to the show. Always great to have you here.
You're welcome. Thank you so much to be back again.
Yeah, well, this is quite the subject. I know there's so much we could talk about, but let's begin with sort of how you are seeing these in your practice.
Absolutely. So I'm a psychologist, and so I don't prescribe these medications, but I work with a lot of clients who they see their primary care doctor who prescribes them, or they see an obesity medicine specialist who prescribes them. And really, the clients that I'm seeing usually are working with me for weight loss, or they've gone through weight loss surgery of some kind or some other intervention. And we're working on the psychological aspects that also come with both kind of these major lifestyle changes as well as these medications, because there's a lot of things happening with them.
Yeah, for sure. And I want to talk a little bit more about that in a moment. But there's been so much data that's come out here recently that you've been sifting through. Can you break down some of that data? What are you seeing?
Absolutely. So I would say these medications, and I would say for the foreseeable future, there'll be lots of new kind of information and research studies that are coming out. But these medications work much differently than how we initially thought. We initially thought these were just going to be gut kind of based medications that act on, hunger and satiety and those types of things, and they do that. But there's a lot of compelling evidence at this point that these really are brain medications. They impact your brain from both a hunger perspective, from a mental health perspective in terms of depression. There's even reductions in suicidal ideation for some groups. Also, substance misuse goes down pretty significantly with these medications. So again, this is kind of a really exciting time of there's now additional options that are coming on. And this could be one of them. So
yeah, absolutely. So what are you noticing when patients come to you that are on these drugs? What sort of issues are they dealing with that you have to help them work through?
Yeah, so I would say it depends what they're usually kind of presenting with. So a lot of times what I'm seeing clients for is that they are wanting to lose some excess body weight, or they're living with a chronic health condition and they need to lose the weight. And so they start trying a medication, and there's a couple different types. The more common ones out there are the Semaglutide, which is just one kind of mechanism of action. And then there's also Tirzepatide, which has two mechanisms of action. And each of them kind of do interact a little bit differently to help people to, for a lot of my clients, it really helps them to take away the hunger or the food noise that so often makes it difficult to make those healthy choices. And so that's a key piece on that. But I would also say there's also reductions in depression that happen with people that are on these medications. Now that's confounded by weight loss, but it's not just that too. There's also some improved cognitive kind of clarity that shows up as well. Misuse of alcohol tends to go down. Misuse of cocaine also tends to go down. What's really kind of interesting is the same pathway in your brain that is being impacted by this GLP-1 kind of receptor piece for hunger also influences other compulsive behavior types of things. So we're going to see a lot more coming out in the future of anything where it's been really hard to, to get some grip on compulsive behaviors. There's some really promising things coming out right now. It's still preliminary, so more research is needed. But there's a lot.
Absolutely fascinating. You were also saying earlier that there are some early data that shows a link with cardiovascular disease and these weight loss drugs?
Absolutely. So in particular, Semaglutide, there was a research study that just came out not too long ago that there was a benefit of the medication to cardiovascular health that was protective above and beyond the weight loss kind of component. And so again, it's one of those things where you have GLP-1 receptors all over your body, not just kind of in your gut, which is where we initially thought these medications worked. But there's some really kind of compelling pieces that are coming out now that suggest that this could be another avenue to also prevent cardiac issues. Sleep apnea was another one that recently came out too. So again, lots of things are being influenced by this stuff.
It almost seems like, the miracle drug out there. So there seems to be a lot of pros or potential pros, but I'm assuming with any drug there are some cons or something you need to watch out for. So
absolutely. Yep. So this is where I encourage all of my clients to talk with your prescriber, the person that actually prescribes your medications, to walk through all of these, because it is very individual on a person-by-person basis. I would say the more common kind of side effects that a lot of my clients experience are the nausea, the GI kind of upset. That's a little bit more prominent with just Semaglutide versus Tirzepatide because there's two kind of medications. That one's a little bit less prevalent. There's also another one about to come out, which is a Tirzepatide. It's another one. It'll be a 3 mechanism of action medication. And so I would say really the side effects can be how your body processes it. And so that's really where right now they're just an injection you take once a week. They're working on a tablet version, an oral tablet version. These pieces are interesting because typically once you've been stable on a dose, the side effects do tend to go down a little bit. But it just is a matter of getting you to the right dose where you're getting the benefits from it.
And speaking of that dose, there are some people who are having issues depending on what they're taking with injecting themselves with the wrong dosage, like too much, yes?
There's a lot also happening, and the FDA kind of even put a statement out recently about this. So there's the name brand versions of these medications which come with an auto injector kind of device, which makes it really hard to influence.
Get it wrong.
You got it, yep. Versus when you go the more generic route, which there are those available right now since there are shortages, those don't come with the same device that can keep your dosage at the right spot. And it gets really tricky the higher the dose goes because you actually need a little bit less of the fluid each time. So it's one of those things where, again, talk with your prescriber, make sure that you know exactly how to do it and how to administer it to yourself too.
Yeah, there seem to be, so many benefits to this that if you aren't, suffering from anything, but you might want to get your hands on it. Has it come to that yet? Where it's like, I'm completely healthy, but I'm seeing all these benefits. Maybe this is something I might want to try.
Yeah, this is where I would definitely say talk with your prescriber. So talk with your doctor about if there's something that you've seen, come out in the news about, well, there's a benefit of this. Could this be a treatment option for me? Talk with your prescriber and definitely say, hey, I saw that there's a new research study that just came out and suggested this. I would say it's always worth kind of having a conversation on it. And I would say too, the data every 6 months there's new stuff coming out all the time. This stuff. So I would say if we do this again like 6 months from now, there'll be a whole new update of stuff.
Wow, you really have to keep on top of it. Make sure your doctor is on top of it.
Absolutely.
Most importantly. All right, well, thank you so much.
You're
Great
welcome.
Information.
Yes, absolutely.
And if you would like to get in touch with Dr. Baughn, you can go to his website, drbaughn.com or danielbaughn.com.